Well, thank you, everybody. We'll go ahead and get the session started today. We appreciate your attendance here. I'm Tom Leahy. I am the Senior Vice President of Sales and Business Development with SureShield. I have our Chief Marketing Officer also joining me, TJ, who is going to be assisting me with questions that may come at the end of the session. But I will be conducting the majority of this and then take questions at the end. I have been in healthcare for actually close to 40 years, and the last 20 in the compliance, risk management, and safety areas, and with a number of different companies that did compliance metrics as well as policy management. And now with our company SureShield that helps a lot in the compliance management areas. So we appreciate you all attending today on this session on sanctions and exclusions, which many of you may be familiar with. And it's heating up right now with the government coming back in to start really enforce more around this. I'm going to talk a little bit about current OIG oversight, some of the ramped up enforcement that's going on and examples of that enforcement. We'll talk as a healthcare provider about many of the challenges you may face in trying to manage this whole process, and to make sure that those who should not be working within your environment are not, and ways in which you can make sure they're not. We'll talk about how you can leverage technology to assist in that process. And we're going to show you some technology that's SureShield technology that's used by a number of healthcare organizations to manage this process. We'll provide you a bit of a product demo and overview, and then at the end of the session, we will go ahead and take questions, as well as for those who may be interested in actually testing out the solution we have, will allow you to raise your hand to say that you would like to do that, and go ahead and work on getting that set up for you as well. So just a couple of housekeeping notes. You'll notice in the Zoom session, there is an area called Q&A. That's where you can go ahead and answer or ask any questions you may have for at the end of the session. As well as there is a chat box as well that TJ will be monitoring during the session as well. And then just for those of you who are on this, you will be receiving this content as well as the webinar recording after the session as well. And hopefully we'll buy you back a little time. I don't think we necessarily will need the full hour. So hopefully I can buy you back a little time before the end of the session as well. So as all of you know, anyone that's in healthcare, the organizations have compliance requirements under the Health and Human Services area. And within those two areas are two specific areas that relate to particular compliance. You have the Office of Inspector General, and this is where we're going to focus the majority of this particular presentation. Under that domain, they require organizations to only work with vendors and individuals who are allowed to be working with federal or state programs, and basically making sure that those who are sanctioned or excluded from that you are not working with them. And as we know, doing so can come with very significant, huge penalties. We'll give you a few examples of those, some that may or may not have been known. Even in the event that you have disclosed, you may have discovered that you have a provider in your organization, you're still subject to penalties. And then, of course, we also have the OCR, Office of Civil Rights, that really is focused on HIPAA compliance. Both of these organizations are significantly beginning to step up enforcement. Obviously, on the HIPAA compliance side, we continue to see increased targeting of healthcare with ransomware attacks, obviously because of the stress that the system has been under and the value of records. And then on the OIG side, that enforcement has significantly stepped up because there are more shady characters that are coming in trying to take advantage of the stress of the pandemic itself. And so understanding that, they're now actually even ramping up the process of making sure that those types of providers are not coming in. And just to highlight some of the significance of penalties that can come with working with the sanctioned or excluded provider or vendor or physician, in the event that one was discovered, any submitted claims that could have been under that particular individual once discovered run as high as a $16,000 penalty that can be charged back to the hospital. So if you had a provider, for instance, that was identified and they had submitted 100 or 1,000 claims, with 100 claims, you're looking at 160 or $1.6 million to be paid back to the federal government. So it's not insignificant. And because of that, again, the enforcement actions are heating up. We know last year there was a little bit of an ease because of the COVID pandemic that made it more difficult for the OIG to enforce, and also to try to provide a little leniency, understanding the stress that the healthcare systems were going through last year and trying to deal with treating patients. But they've also identified that activities and fraudulent activities are beginning to significantly increase, and as such, their intention is to increase the enforcement of that. So it makes it even that much more important that you have good systems in place to make sure that the providers, the vendors, the employees that you have within your organization are allowed to be working in that and not to be, and can be working with federal or state programs. Last year alone, there were over 1,400 sanction and exclusion actions that were taken. And that was with a system that was a bit constrained with resources. So you can expect that you're going to continue to see some very significant increases. As we know, when the government provides money, they're also always looking to make sure that they can recoup it. And they actually have these agencies that are put in place, obviously one to help protect the public interest, but the government's always looking to recoup. So they're going to take extra, precautions to make sure that if there are opportunities to recoup dollars for activities that are not correct, they're going to do that. And in 2020 alone, even under a constrained system, there were over $6 billion in investigative and audit receivables that were collected. And a lot of that was around, various criminal activities, but then also sanctions and exclusions violations that are part of that. So I won't go into detail. I think an excellent place you can go to see where the sources of some of these activities are will tell you a lot around the different types of areas that they're focusing on. And again, the actions and results that they're looking for to reduce this. So we had in the case of places like the McAllen Nursing Home, and these are all very recent, that ended up paying a very significant penalty for having a person operating in their environment that was forbidden or sanctioned from doing so. The same could be said for this Colonial Advanced Rehab Center. And then recently in August of 2021, a health center in California also had an issue where a credentialed provider was working in an environment that they should not have been working with. And as such, caused that, once identified, caused that institution to pay some pretty significant penalties for allowing that to take place. So why is this kind of a difficult process? And we're going to take a brief pause after this to take a small poll with the folks who are here to try to get an understanding how you may be doing this. But as you know, the process of managing the exclusions and sanctions process can be very time consuming, very manual and expensive. It can be very cumbersome. As many of you know, there are over 4 federal databases, and depending on your organization, if you're operating in multiple states, there's over, I believe, 38 different states that have their own databases that need to be checked as well. And they're not continual in nature, meaning for the most part, these are periodic spot checks. When you're doing this, you're getting that information at that point in time. And you could be in a situation where you have someone that's in your environment that was okay to do so, and a month later they were not. And that puts your organization at significant risk. If you're not checking that, or you haven't checked that, you run into the risk of what we talked about before, claims or services that could have been rendered that will then have to be paid back to the government. And then oftentimes they, organizations rely on outside resources to help them with this. But in all cases, none of this is continuous necessarily in process. So I'm just going to take a quick opportunity to take a brief poll and ask, for folks that are here today, how do you go about doing this process? The OIG recommends that optimally you are doing checks at least monthly. What we find is a lot of them are doing those perhaps just on new employees or new vendors. But I'm just going to take a brief poll of the audience to try to get a sense of how you do this, how often you do this. And we'll just give it about 15 seconds for you to go ahead and answer those questions. Excellent. And so what I'm seeing is about half the audience is saying that they have good processes in place, are doing it monthly, hopefully doing it monthly. And others are actually not sure. Perhaps this doesn't fall under your domain or your responsibility. And with that, to just add on to that particular question, I just want to take another brief poll around how are you doing this? Is it through a third party? Is it manual? Again, whether you know or whether you have software to do this. Great. And again, with the audience here, it looks like a number of you are doing this manually, or you're sending it out to others to do. Some may have software that you're doing this with as well. But it looks like the majority of you who are doing this on a regular basis either do this manually or through third-party spot checks that are done. Excellent. So we're going to go in now to talk a little bit how, with that, technology may be able to help you in doing this much more efficiently and effectively, and doing it in a way that's continuous as well. So we have a solution. It's marketed under the auspices of the Integrity Shield. And Integrity Shield has a number of different things that it does. So, and one of the areas in particular is to help with doing real-time automated sanctions and exclusions checking. So it really helps with oversight of all the integrity management processes. It takes a lot of what you might be doing manually or with third parties outside that you're doing spot checks on, and allows you to manage all of this with some technology that will do this continuously. When I say that is, once you have brought in any of the employees, any of the vendors, any of the docs that you have within your system, it will, on a nightly basis, check and make sure that there's been no changes to the status of those providers. And what more importantly, it will alert you if there are changes. So it has what we call exception-based information or exception-based rules that will let you know what needs to be acted, needs to be acted on. It allows you to distribute that work to others. So you may have folks within the organization that do employee-related items. You may have folks that are doing the providers within your organizations. You may have folks that are doing the supply chain piece. It allows you to bring that all together into kind of one comprehensive area, but allow others to manage that process. And what are some, as I mentioned, the key features of this? It's real-time automated continuous monitoring of multiple databases, meaning it goes into every single one of the sanction and exclusion databases that are out there. And it will be checking those on a daily basis to see if there's any changes to those databases or the status in those databases. And they're marrying that up against the providers that you have within the Integrity Shield application. It's really simple to set up. At the end of the day today, or at the end of the session, we'll go ahead and give you the opportunity to even test it out and try it for yourself. But setting it up and starting with it is very simple. It just requires the process of loading the folks that you want to have checked, or all the new ones. And then it runs into think of like it is almost like a auto robot that works for you as a resource. It'll provide those checks on your vendors, your employees, your contracted workers. We also have a component of it, if folks have interest in those, that can even do vendor management and HIPAA risk assessments on the vendors within your environment as well. And then it will provide you, a lot of good insight into all the oversight of that. With any of the vendors, the employees, the docs you're working with, you have a lot of different reports and the likes that can be run through this. So if you look at this, and this has actually been updated to 38 states, you have 38 different states that have their own oversight or exclusions and sanctions list, along with 4 federal databases. So trying to manage and do this all in one area is pretty difficult if you're doing it manually. And therefore, what we find is a lot of folks do this on not on a continuous basis. For those of you that are doing this monthly, if you're doing it on all of your vendors, then that is fantastic. Many may be doing just different monthly spot checks on a series of different folks, because either in a small or a large organization, that's difficult to do. So just to give you a little understanding of the back end before I go in and show the application, is what we've done is we've sourced all those different data sources. We've put them into a back-end database, and then we are constantly scraping and checking that database to see if there are any changes in that. And that then goes into the dashboard, matching that up against the entities that you have within the Integrity Shield software, to check and see if there's any exceptions or there's any differences in what was there today and then what's there tomorrow. So in that sense, it's doing a continuous regular management and oversight. So for those that you are doing it monthly, you would be now doing it daily, if you think about it. And those of you who are doing it manually, you would now have a system that basically does that for you on a daily basis. So I'm going to pause here for a minute. And TJ, I did see that someone had raised their hand while I was presenting. I don't know if I should stop to address that right now, or whether we should go ahead on into the demonstration. And I will take that as we will go on into the demonstration briefly and then get to the questions that folks may have. So just as an example within here, what I've done is I've gone ahead and I've signed into what we call the Integrity Shield product. And this is an offering, as I mentioned, it's software offered by SureShield. And what you're seeing is it's a dashboard-based system. So what it's right now showing me within this particular Bloomfield Clinics organization that I'm working with, keeping in mind in our solution, it's a white label solution, so it's customized to your organization when and if you use it. But in the case of Bloomfield, you can see it's showing me within my environments, I have 209 different types of records in here. 20 of those are employees, 166 of these are entities, and then 23 of these are individuals. Individuals could be people like physicians, individual contractors, folks of that particular nature. So it gives me a breakdown of those individuals. And these are the ones that I am monitoring within my system right now. Sorry about that, I accidentally hit mute. And so when you are in the system, then as I mentioned, it's kind of a dashboard base. I can click into these, and then it's going to give me a breakdown of all of those different entities that are within my environment. So you can see if they're business associates, if they're contracted workers, if they're employees, if they're vendors, if they're individual vendors. Again, all of this these are areas in which you can filter on the data that you have within here. So if I wanted to go and take a look at those that I had that were sanctioned, you can see it's going to filter that down and only give me those particular entities that are in here. If I were to click into those, it will open up and first of all show me, and again, keeping in mind this is an exception base. So if someone had all of a sudden within my own contracted vendor network became identified as sanction or exclusion, there would be a notification that would go out to you or to someone who is managing this to tell them that there's an activity that's taken place that you need to take action on. And simply I can go into these and take a look, and it will show me what the source and the match source was for that, if they have that information, because not all databases do, what the type was, what the particular exclusion type was, and what particular actions may have been taken on that. So if I were to go into this one, this was someone that was convicted of a program-related crime and excluded for 5 years. Again, when you are setting up the system, it's actually quite simple. There are a couple of different ways in which we work with an organization. One, you can simply add new records. So if you have a new entity to add, or a new individual, or a new contracted worker, whatever that may be, you can do that in a manual process. You'll also note with a lot of the folks that we work with, particularly when we start off with them, we'll get a listing of all of those different types of people within their ecosystem, and then we can upload them into the system. And or we also have APIs that can go into things like your employee database, your physician database, and your vendor database, and have those be real-time updates to them as well. So if I were, let's just say we'll make an example of TJ, and let's hope that he has not been he's not a bad boy, basically. So he's going to be a perspective. And again, this is something that can be used ahead of time, which you obviously should be doing, is to check on your vendors or your employees that you're considering moving in. I can go simply to these areas, and it's going to do a very quick spot check right now to determine, as it's checking those databases, whether there is any information that's showing up on TJ that would give me reason to perhaps not even get him started in this process as well. Once TJ is in, Now the system will be looking and measuring against those 42 different databases to see if anything's have changed. And again, the benefit of this, even if you're not participating in different in states outside of just one state, this also tracks past history. So if there's any past history on an individual that has come in, the system will note that and give you information to let you know that that has taken place, or that you may have someone that was previously excluded. Or you could even see that you have someone that was excluded from participating in a program in a different state that may give you pause to to decide whether you're going to work with them in that particular area. So again, really simple and easy to work with. As I mentioned before, if I go into these areas on the home, anything that comes up as new activities or actions that I need to take on this would show up in a dashboard to tell me of tasks or work items that I may have to do here as well. Let me just go back to the Bloomfield clinics. And lastly, beyond the automated reporting you're getting, so you can see over here, there's some task items that have popped up for me in terms of priorities that I need to take based upon information that has been recently updated in the system. You can, when you've identified someone, let's just say that perhaps was sanctioned, or you believe was, or it came through, you also have the ability to even validate that. So you can go ahead and do things like request responses. So occasionally, as you know, you could have false positives that come up. This allows you to actually very quickly send out information, request verification, request, if you want to check on that, hey, we got this notification that there's a sanction. We'd like you to provide supporting documentation as to whether that, for any reason, should be considered incorrect. So you have a lot of different types of follow-up and workflow activities that you can utilize and take within the Integrity Shields for sanctions and exclusion checking solution as well. And then lastly, of course, many of us may need to have different types, a number of our customers need to do reporting to their boards, particularly those that are dealing with a fair amount of federal related reimbursement. They have different reports that they can go ahead and run on the providers, what the status is of all the providers within here. If I were to pick this up, again, you can see I can segment this by what I want to look at. And if you're an entity that, for instance, has multiple sites or multiple units, and you want to be able to segment those out, we also allow you to set up what we might call those sites or locations. So you can see in this case, there are two within here. If I wanted to just look at what's the status that I have with a particular provider or a facility in Pittsburgh, then I can run it on that basis as well. So all that type of filtering allows you to configure and manage your reporting requirements very easily. So in this case, if I were to just run on the entire data set, it's showing me all the providers within that entity, those that have been designated as sanctioned, and hopefully I've gone ahead and made sure that we've moved them out of our environment. But will, at any given point in time, give you that oversight as to where things are at. And lastly, you have the ability to schedule these reports, save these reports, output these reports in a schedule. So if you wanted to go to someone on a certain regular basis, all of that is available for you to do within the sanctions, Integrity Shield Sanctions and Exclusions product offering. So that is our solution for doing this. As we mentioned, it's a continuous self-monitoring application. So for those of you that may be sending this out to providers, or those of you that may be doing it manually, what you get with this and what our clients really like about this is that process of it being continuous, real-time monitoring for them as well. I'm going to go back to the PowerPoint briefly, and we'll go ahead. And as I said, I was hoping I would buy you back a little bit of time, and it looks like we will. We'll go ahead and finish up this portion of the presentation. And then we'll get into, for those of you that have questions, I see there's a few areas in the chat that I have not been able to look at yet. But for those of you that may have questions, please go to the Q&A area and enter those questions. But really, the benefits of the Integrity Shield for sanctions and exclusion checking, it's a really simple, easy to use interface. As I mentioned, you can complete and distribute workflow. It helps you meet your regulatory, these are compliance requirements under the OIG, and really manage this process that's going to, again, be more focused on, given the focus on reducing, bad apples coming into the environment. As I said, they'll continue to ramp up enforcement. And leveraging tools like this to help in that process can help make your life easier and help protect your organization that much better and safer as well. So we're going to go ahead and open this to Q&A. And as I mentioned at the end or the beginning of the presentation, this, if you're interested in even just testing this out, it's very simple. We can set up a process for you to even to go in and test it against some of the employees or vendors or others that you may have in your environment. So if there's an interest in a follow-up and being able to test this out at no cost, I'm going to go ahead and launch that particular poll briefly. And then while we're giving you a chance to answer those questions, we'll go ahead and go into some of the Q&A around this. Okay, so I'm seeing one of the questions is, what are the required demographic fields? Actually, it's very, very minimal. Of course, the more you have, like a TIN for a vendor or other more specifics, you're going to get a better ping on the database, to matching on the database. But you do not necessarily, you don't have to have an SSN, you don't have to have a TIN. Typically, basically, we need the name of the vendor, what type of vendor that is, or what type of who that person is and their name. Obviously, a little bit more data that you have in terms of demographics will be able to do a closer match, because there's, for instance, a number of John Smiths out there as an example. So hope that answers your question. You do not need a lot, but the more that you are able to input, the more information and better the matching will be on this. And it looks like we got that. I see that was a question on the demographics. Okay, and then there was another question on costing. How is this costed out? Pretty straightforward. This is a solution developed by us. We basically look at the relative size of the entities that you have, and then it's an annual or a monthly licensing fee for that. So once we know, for instance, how many employees or vendors or physicians that need to be monitored, then there's basically costs for numbers of entities, and those costs are in the 3 to 5 figures, basically. Very inexpensive, or 4 figures, I should say. Let me see if there's other questions here. So one of the questions was, how do I get notified? As I mentioned, if you will set up users in the system, and those that are, for instance, administrators of the data, the notifications will come not just through the application, but they'll also come to you via things like emails. So if there is an exception that comes across, you're monitoring, let's just say SureShield, and SureShield's one of your vendors, and at some point, hopefully not, SureShield has an issue, then you would automatically be informed via the application with a push notification and via an email that there's an issue, and it will then allow you to go in, look at that information, and then decide on what it is that you need or should do with that, and actions that you can take on that, whether to remove them, to cancel those agreements, to remove that in case of individuals, to remove them from services within your organization. And then the last is, does it matter what type of healthcare organization you are? The answer is no. Anyone that obviously that's servicing as a CE, a covered entity, whether that's a hospital, whether that's a nursing home, whether those are physician practices or clinics, all have these requirements that are required to be doing sanction and exclusion checking. So we have hospitals that are working with this solution. We have managed care clinics that are working with this, and we actually have a managed surgical institution. Basically, they manage outpatient surgery centers on behalf of hospitals that are doing this because they have to do those checks on all of the providers that are working within those as well. Great. So I'm going to go ahead and end the poll. Looks like a couple of you had indicated that you would like to test this out, so we will follow up with you. And for those that have indicated no or maybe later, please keep us in mind. And you may want to do some research on what you're doing now, or you may find this to be something of use for you in the near future. As I mentioned at the end, later on today, you should get a follow-up with information with the content of the presentation, as well as the recording of the presentation. So I'm glad we can bring you back a little bit of time. If there's anything else you may need, or you're interested in learning more about SureShield, please feel free to go to our website. That's sure-shield.com. Or you want any other information on this or other products or services we may have, you can always reach out to us as well at info@sure-shield.com. So with that, I would like to thank everybody for your participation today. And glad we can buy you back a little time, and please reach out to us if there's anything else you may need. Many thanks again, and appreciate you all joining us for this session.